Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Granuloma inguinale is a sexually transmitted infection, or STI. It is a bacterial infection. The bacteria affect the genital area. This infection is uncommon in the United States, but it is more common in tropical and developing countries. This infection is treatable. Early diagnosis and treatment are important. They can prevent serious complications. These complications include damage to the genitals. It is essential to practice safe sex. This can prevent the spread of granuloma inguinale. If you think you may have this infection, see a doctor immediately. Remember, early detection and treatment are crucial for managing granuloma inguinale effectively. Granuloma inguinale is caused by a specific bacterium. The bacterium is called Klebsiella granulomatis. This bacterium spreads through sexual contact. The bacteria enter the body through tiny cuts or abrasions. These cuts can be in the skin or mucous membranes. Mucous membranes are the moist linings of body openings. You can get granuloma inguinale from any type of sexual contact. This includes vaginal, anal, or oral sex. You cannot get this infection from casual contact. Casual contact includes hugging or shaking hands. It is important to note that having granuloma inguinale once does not make you immune. You can get it again if you are exposed to the bacteria again. Always practice safe sex to protect yourself and your partner from STIs, including granuloma inguinale. Granuloma inguinale often starts without noticeable symptoms. This can make it tricky to diagnose early. However, as the infection progresses, certain signs become apparent. One of the first signs is a painless sore. This sore can appear on the genitals or nearby areas. The sore may be beefy red in color. It can bleed easily if touched or scratched. As the infection develops, these sores can become larger. They might develop raised edges. These edges can look like a cauliflower. The sores can also spread to the surrounding skin. If you notice any unusual sores in your genital area, do not hesitate to seek medical attention. Section 4. Diagnosing granuloma inguinale. Diagnosing granuloma inguinale requires a doctor's expertise. They will first ask about your medical history. This includes your sexual history. They will also perform a physical examination. During the physical exam, the doctor will examine the affected area. They will look for the characteristic sores. The doctor may take a sample of the sore. This is done with a swab. The sample is then examined under a microscope. This helps identify the presence of the bacteria. This microscopic examination confirms the diagnosis. Early diagnosis is crucial for effective treatment and preventing complications. Section 5. Treatment options and management. Fortunately, granuloma inguinale is treatable. Antibiotics are the mainstay of treatment. These medications help kill the bacteria causing the infection. The doctor will prescribe the appropriate antibiotic. The antibiotic is usually taken for several weeks. It is crucial to complete the entire course of antibiotics. This ensures the infection is completely cleared. Even if the sores start to heal before completing the antibiotics, do not stop taking them. Stopping the medication prematurely can lead to the infection returning. It can also make the bacteria resistant to the antibiotic. It is important to follow your doctor's instructions carefully and complete the full course of treatment. Section 6. Prevention and public health measures. Preventing granuloma inguinale involves responsible sexual practices. Using condoms consistently and correctly is crucial. Condoms act as a barrier. They prevent the exchange of bodily fluids during sexual activity. Having open communication with your partner about sexual health is also essential. This includes discussing any history of STIs. Regular STI testing is recommended for sexually active individuals. Remember, granuloma inguinale is more common in certain regions. If you are traveling to areas where the infection is prevalent, take extra precautions. By understanding the causes, symptoms, and prevention methods, we can work together to reduce the spread of granuloma inguinale. UMCC, your ultimate medical consultant.